How did we get here?
What are you seeing behind those closed doors that we don't see?
There's a reason why physicians commit suicide. It's just not what we're trained to talk about.
What needs to be fixed?
Give the antibiotic, give the Percocet, give the Xanax. What chance do our kids have? That's what primary care is in the United States. Mission impossible.
So why is this message not out there?
Well, there's money. Why do we prescribe more oxycodone in this country than any other country in the world?
I'm an addictive personality, so it's either all in or nothing.
So I love my patients, but I can't do everything.
I mean, that's just pure crack cocaine for kids.
It's cost effective, and there's fewer side effects, and it's cheap, and it's available to everyone. If people don't know, they should know.
Beautiful day. Good morning, guys. Here with Anthony Kaveh. He's an anesthesiologist here in the San Francisco Bay Area. And you're also a
Integrative medicine specialist.
Integrative medicine medical specialist. So today, guys, we're gonna talk about the medical world. And I've seemed to find there's a big gap between us citizens and what's going on behind the closed doors in hospitals. So we're gonna talk about, let's say, some of the disconnect, some of the challenges, some of the things that aren't going so well at the moment.
I can't think of anything.
Brave Anthony's here with us to do so, but it's not all doom and gloom. We're gonna talk about some of the ways all of us, you, me, Anthony seems to have it figured out so far, but how we can implement things in our lives to make them much better during these COVID times and just life in general. So Anthony, what's the biggest problem you're seeing right now? That's a wide question, but what are you seeing behind those closed doors that we don't see? And as an anesthesiologist, you're seeing people on the line of life and death, right?
Every day we see people right on the line, and yet our society has been looking a lot like a penny wise, pound foolish kind of story.
Okay, what do you mean by that?
So imagine trying to save a couple pennies here and there, but then in the long run losing pounds and pounds and pounds. Or we look at, for example, masks right now.
Right.
We recognize there's a very real benefit to masks in the correct situation, and we recognize that the risk of transmission in situations can be very low. We focus on the things that might save pennies, like masks in outdoor settings where the risk for transmission is low, but we're unfortunately very mute about the pound.
Okay.
About what are the underlying risk factors that increase the risk for severe COVID infection, for example.
Okay. So why do you think there's no attention on these overall factors? These, you know, there's sort of some big themes here, but like overall health and society is going to better society, right? Why is there a lack of attention on that?
A healthy society is good for you, it's good for me, it's good for every single person, because we're all invested in the healthcare system. If someone can't pay for it, you and I have to pay for it at the end of the day.
Right.
And money's a finite resource people forget. If somebody is using too much of it, unfortunately that might mean less for somebody else.
What are you seeing, Anthony, when people are on that line, you know, between death, life and death, you're that guy holding them there, which has got to have a lot of stress and obviously responsibility. What are you seeing in the health of society, or what can we learn from that? I'll let you take that one.
How did we get here?
How did we get here?
How did we get here? Something that people need to recognize is that in the operating room, in the emergency room, in acute medical settings, we do a phenomenal job with Western medicine.
Okay.
We save lives. When you get hit by a car on the highway, if you're unfortunate to have a gunshot wound, you have a bad accident, we will do the best job with our cutting edge medical devices and all those things, undoubtedly.
Sure.
But this is the minority of what costs us as a society, and what costs us as a medical care system. The heartache, essentially. We see the sick people out there, and it's rarely from these types of acute conditions. It's usually from the consequences of high blood pressure, from poor nutrition, from obesity, from diabetes. When people get their amputations from their diabetes, when they don't have eyesight from their diabetes, when their kidneys fail. This is what constitutes a lot of what we see. And when they end up on the OR table because they need their limb amputated, or they have an aortic aneurysm because they've been smoking their whole life. How did we get here? What happened for the years and decades we had to intervene to help prevent this from happening? It breaks my heart.
Hot dogs in schools aren't helping for kids?
Well, I mean, maybe the Doritos help sometimes. I don't know. But I don't know if I can say brand names like that. But yeah, the vending machines to the kids, the targeted advertising of unhealthy habits to our children,
right,
does not help.
So what do you think? You're in the medical world. The reason these things are not being talked about at a, there's not a lot of volume on this topic is because where's the money to be made? It's not on prevention. I'm going to throw you under the bus a little.
Oh boy.
Say whatever you want, obviously, but it's not prevention, right?
Yeah, unfortunately, an ounce of prevention is a pound of treatment. But we're disincentivized. It's the plain, unfortunate truth. And if people don't know, they should know.
You're disincentivized as a medical worker, as a hospital, what?
Well,
pharmaceutical company?
Dude, you're
typically
famous.
Now you are.
Awesome. Yay! Thank you for great work you're doing.
Thank you.
Great work.
You're a very health conscious individual. I can tell.
I am. I'm jealous of you. I want to be doing what you're doing.
Oh. Do it. Grab a GoPro.
This guy's a serious YouTube.
Okay.
Anything we do, there's always a risk and benefit. Anytime someone's having surgery, for example, yes, you might take out the appendix and they might be just fine. They probably will be fine, but they could also die on the operating table from complications of anesthesia. They could die from an infection.
Right. Can I tell you one of the experiences I had in the medical world?
Go for it.
And I've been to the doctors very, very few times. I've had very
Good
few
for you.
injuries, luckily.
Good for you.
So I was on a mountain. I was mountain biking. Crashed the bike, broke my finger. Got splinted up, healed up fine. A few weeks later, I was getting this tingling down my arm when I was sleeping. And so I went to the doctor and I said, Doc, I'm getting some of this tingling. Is there anything I can do? And he did this. Do you mind?
Go for it.
He's like, see, Peter, what we'll do is we'll just take out this top rib here. So we remove this, it will free, I forget how he said it, but like the nerves will become unpinched, blah, blah, blah. We just gotta remove that part.
Yeah.
And I felt like I was talking to an auto mechanic about my suspension not working. And I said, Doc, what about yoga or acupuncture? Is there anything else I could do? I'd rather not start dismantling my body over some tingling at night.
Yeah.
And he assured me, no, that won't work. Not gonna happen. And I didn't follow his advice, thank God. 2
You
weeks.
still have all your ribs in place?
I still have all my ribs. 2 weeks later, it went away.
Went away.
And I haven't felt it since.
We call this the tincture of time in medicine. Tincture of time.
God, it's got a saying.
Oh, of course, because this is what you just said. Things are on a spectrum, and the body has an incredible potential to heal itself. Undoubtedly.
Okay.
Nobody makes money when the body heals itself. We need to face it.
So, he's making a sale.
I do want to be careful. I wasn't there. I don't want to speak for the surgeon. I don't know what your symptoms were. But traditionally, the truth is that when we go to medical school in the United States, we are trained to deal with acute situations, which we do very, very well.
Right.
We are not trained for wellness. We're not trained for health optimization. We are typically not trained for low risk interventions.
So who is trained for that, and who is, giving us that information in society? It's not the CDC, right? We're not having our big organizations telling us how to live. I mean, I'm sure there's stuff on their websites, but I don't feel like there's some, especially this year, you think there'd be like, okay, the best thing you can do for yourself is get in a really good health. I've failed on that a little bit this year. I've doubled down on my chocolate intake. I've doubled down.
Go for the dark chocolate, 100%.
I'm not a purist like you. There's not as much dopamine in it because let's face it, shit food gives you a rush, right?
But did you know that you can retrain your body? Did you know that the dopamine rush can be trained? No, we don't talk about it.
Let's go over here. Let's check this out.
The palate adjusts. The palate adjusts.
I don't know. That's a big sale, Anthony. How does my palate adjust from a nice? Because sugar is the dopamine. It's the quick hit.
It is, but there's more than just sugar that can do it. But see, that once again, what incentive does anyone have to try to explain to you how your lifestyle can fundamentally change your physiology? It's just not what we're trained to talk about, because And it's not the fault of doctors. We have 15 minutes maybe with a patient, maybe 20, 30 minutes for a first time encounter.
You guys are pressured hard these days, right?
We are pressured hard. It's not a sob story, it's the reality.
Right.
We have very limited timing because do you want to be late for your appointment?
No.
I mean, sorry, you don't want the doctor to be late to see you, right?
Right.
Well, then if you can't take extra time with your doctor and have the next patient be late, right? I mean, it wouldn't be fair. So
Right.
we need to be on a timetable
Yep.
to keep everyone happy. It's really mission impossible. That's what primary care is in the United States. Mission impossible. They ask way too much from primary care docs, and there's no way they can deliver. Who's gonna sit down with you for an hour to talk about how your body can heal itself? Who is gonna sit down and do that?
Right.
We're not trained, we don't make money because we don't get compensated as much for preventive things as we do for acute fixes.
Okay.
And I'm not going to comment on the right or wrong insofar as to say that you can tell me if you would rather have somebody spend an hour talking with you about your lifestyle
Right.
and how you can prevent it versus being on the OR table 20 years later because your coronary arteries are filled with junk from the lifestyle that led up to that.
Okay, what percentage of your patients are there because of bad choices in life?
Recognizing that we don't have the absolute truth number,
Yeah.
it's probably going to be well over 50%, probably in the 75% line.
Okay.
But it depends on many factors, and I got to say this to be complete here. There are going to be some cancer centers that look at only specialty care in pediatrics. The child with a glioblastoma in the brain, it's very difficult to say what led to that.
Yeah, sure.
The child who's got a tumor in their eyeball, difficult to say that it was a lifestyle choice.
Yeah.
Versus the older woman with uterine cancer with risk factors that we know revolve from elevated BMI and obesity.
Gotcha. So what do you want people to know? You reached out, you said there's sort of an information gap these days in your industry. I hate to call it an industry, but that's what it's called, right?
Well,
it's an industry? Okay. There's an information gap between the public and your industry. I mean, in a nutshell, these are all like 5-hour-long conversations we could have, every one of these topics. But what needs to be fixed in this sense? Like, what would be some remedy, quick fixes? I hate to say that. I don't want to say Band-Aids. We need deep dives, right?
We need deep dives.
Structural deep dives.
But it starts, yes, at the organizational level in terms of community structure and public health. Of course, this is going to be the bedrock. It's unequivocal how important this is. But there is also personal responsibility and agency. And this is the beauty, the elegance of the human body. It can heal itself with the right empowerment. And to answer your question of what is the single most important thing is patient empowerment. Everybody can heal themselves to an extent, but their environment may not enable them to do so, which is why it's a two-pronged approach. Of course, the community and the environment has to be optimized, but we can never forget that the patient themselves has incredible potential to heal their body.
How is that approach now? It's approach that the patient doesn't have incredible control over their destiny, or what do you think on that?
No, absolutely, you're correct, because the message is that you see commercials for antidepressant medications, for erectile dysfunction medications, instead of addressing the underlying cause. What we forget is that all these drugs that are pushed out there have side effects. This is why what I said earlier, in Western medical approaches, we unfortunately forget the risk-benefit of every recommendation we make. Everything as benign as any medication may have potential, tremendous potential for benefit, but also has potential for problems. And this is the opposite of patient empowerment, where we look at lifestyle, where you nearly unanimously have tremendous potential for benefit without the side effects and with less cost. When we look at 20% of GDP going to healthcare costs, the lifestyle modification components don't contribute to the 20% number that we're talking about.
Right. Let's go up here. Here we are in Golden Gate Park, guys. Such a beautiful park in San Francisco. Okay, so there's a lot we can do on an individual level, but it's hard. I'm not in my optimum shape right now. I've been in much better shape before.
Why do you stay in prison when the doors are wide open? We know a lot of I don't know. How?
No, it's good. How?
is hard.
How do you do it? It's
Yeah.
nice. It sounds good,
Yeah,
Anthony.
yeah.
Like I'm empowered, but I'm also empowered right now. I have a craving to go get that, that cookie after this
Yeah.
talk, right? So you're empowered, yes. Okay, but give me a little more on that. Like you're a strong-willed guy,
Yeah.
and you're seeing it. I guess you have an advantage too. You're seeing every day at work the fallout from bad habits.
We all are, but yeah.
No, you more so.
Well, yeah, but anybody who's sending a check to the IRS who knows that their tax
Yeah,
burden
but
is.
there's a disconnect. There's
Yeah.
a
No, you're right.
disconnect.
You're
Like
right.
you're not connected. You're not up
I'm
close
tongue in
and
cheek a
personal.
little bit, but yeah.
You're in those hospitals. You're seeing people dealing with type 2 diabetes, which you just scared me about because that comes from eating too much sugar, right?
Multifactorial, but yes, lifestyle and refined sugars
Yeah.
are one of the strong contributors we believe to developing, and particularly in children. And when children develop type 2 diabetes, it's the worst case scenario for us all
Yeah.
because they have a whole
they're-
life ahead of them.
They're on the system their whole life. They're in the healthcare system.
And not to mention their own personal life loss. It breaks my heart. I was telling you the other day, I had a patient in the operating room, 12 years old,
Let's go down here.
who weighed over 200 pounds.
12?
12 years old.
200 pounds.
Over 200 pounds. And,
So what's his chances in life?
well, there's unfortunately a trajectory that is not fixed, but is likely. It's all about probabilities.
Okay.
And unfortunately, when that happens, that patient still has the potential to turn things around. The human body can recover, but it takes all the more willpower and acceptance of responsibility.
Okay. So is it fair to say that elements of the system look at that as a perfect patient because there's a lot of money that's going to be spent
Yeah.
on his life throughout his life if he
Well,
doesn't change?
You know, it's funny you say it that way because it's in some ways money to be gained from the treatment that comes from long-term insulin, from anti-diabetic medications that one may take, but it's also moral injury to the healthcare system because we're human beings. As doctors, it breaks our heart. It hurts. We don't want to see that child sick. We don't want to see their parents sick.
Right.
But what tools do we have when we're constrained in a system where we have 15 minutes with the child and their parent to talk about the lifestyle modifications? You ask, what do we do? Well, it starts with education. Empowerment starts with education and awareness. But it's difficult to give these tools to patients when the cards are stacked against them. The cards are stacked against us all in this type of...
Okay, one way to unpack, I would say, okay, easy food choice is fast food.
That's an easy example.
That's cards are stacked against you, right? And I was just in Southern California, and so commercial real estate, right? We all think in California, commercial real estate, or maybe across the nation, is in the gutter. Like downtown San Francisco, for lease signs everywhere, right?
Yeah.
Commercial properties. But I was talking to a commercial agent down there. I'm like, how's the industry thinking the answer is going to be terrible? He said, oh, my work is great right now. I'm like, whoa, how's that? He's like, fast food restaurants opening up left and right because of the pandemic, I guess, right? Because it's easy to go in and get takeout.
And yet, while masks have a role, the role is pennies compared to the pounds of that type of lifestyle nudging people.
Right.
I mean,
So, okay, how about this, Anthony? What the irony? Everyone has a mask on here outside as we're talking about pennies and pounds with masks. What's your take on that?
everyone has a choice to do what they want.
Okay.
And I will respect their choice. It is inconsistent, however, to place so much importance on a 0.01% risk versus a 1% risk. And the 1% or 10% risks come from an accumulated lifetime burden of fast food and unhealthy lifestyle choices that far overshadows the 0.01% risk. Recognizing these are somewhat arbitrary numbers, but orders of magnitude difference.
Yep.
Versus what we saw, and comparing what we saw earlier to what most people are subjecting their bodies to on a daily basis. Wearing a mask can be it is very important in the
Yeah,
right setting.
give us the lowdown on that, please. I have my theories. Here's how I operate. Outside, if I'm not close to people, there's ventilation, UV light from all the doctors I've talked to. Outside, that risk is so low. They told me don't wear a mask. Around people, up close and personal, inside definitely, I wear a mask. Are you at liberty to say this, or is that too controversial from your...
That's a very reasonable approach. I carry a
Okay.
mask with me because I might run into somebody.
Yeah, and I have one with me.
We both have a mask on hand.
Yes.
When we're looking at the 0.01% risk, my personal risk profile is that I try to optimize everything, but even I don't believe that 0.01 or, you know, roughly with this, if you want to calculate it however you want in an outdoor setting, is very low.
Wait,
And
it is very low.
it is
Yeah.
low. It's undeniably
Yeah.
low.
Yeah.
And there's realistically more things that are going to kill us than being in an outdoor setting, not wearing a mask. Recognizing that we have a mask with us should the environment change, because hey, we might go into a cafe right now and that's a different risk.
So what this leads to also is what you're saying earlier, is fear, right? And so if we're in this constant state of like on the heels instead of on the toes, worried, feeling in fear mode, in panic mode, that also hurts overall well-being and health, right?
It's risk benefit.
It's hard to measure that though. It's really hard to measure that.
Yes and no, because like we were saying earlier, everything is a risk benefit. Every decision we make in life has a risk and a benefit. The risks of fear and a continual state of concern and worry is actually not that difficult to quantify. We have heart rate variability measurements, we have galvanic skin response measurements.
Sure.
There's so many ways of quantifying the burden of persistent unmitigated stress, elevated cortisol levels, etc., that have very negative impacts. And living in a state of fear, particularly in childhood, can result in long-term psychologic and physiologic problems.
And I've seen it in many ways, like being in the hoods. You know, there's this people are worried about safety, and they're always on edge. You know, when I was did this video in Miami, in the hoods of Miami, right? The guys I was with, really cool guys. But when they got in there, because we're on Miami Beach, they were chill. When we got in there, it's like their guard ramped up. If you're too relaxed, it's actually a danger for survival, meaning you're an easier target. So you have to have that fear mode up to exist, which has to be unhealthy, right?
It's unequivocal. This is not controversial. That living in a constant state of fear not only hurts your psychological well-being, but very much so your physiologic well-being. Undoubtedly, there's no question.
So why is this message not out there on a macro level, at least in the U.S. right now? I don't see it. I don't hear it. Why is there not an overall well-being approach?
You think there would be, because like we said, an ounce of prevention is a pound of treatment.
Right.
Yet we don't have that type of incentivized public health structure. Looking at the macro scale, we don't incentivize these things.
And in your training in med school?
So that the public health system doesn't do it as well as it could. It does a good job in many ways, and we're not downplaying it. It does a good job, but there's much more. There's always room for improvement. We're not bashing, always room for improvement. At the individual doctor level, it's partly not our responsibility the same way as it is a public health message, because we deal, like I said, we deal with acute people. We are trained to save lives. When someone collapses right here, we know how to do CPR, defibrillate, then we save lives in the moment very well. When we go past that, we drop off very quickly in our cost effectiveness of prevention and treatment. We can do it, but not cost effectively, because we have 15 minutes at a time. What are you gonna do? A patient lives their 99% of their life at home, at their school, at their work, whatever. What is 15 minutes in the office realistically gonna do other than manage some medications, try to talk about smoking cessation, trying to talk about lifestyle, and then got us to the next patient, because we don't want to get a bad Yelp review if we're late to see patients. Let's face it, we're under so much scrutiny. What are we going to do?
Is it getting harder in your industry?
Undoubtedly it's getting harder.
It's getting harder for doctors, what, in the last 5 years, 10 years?
It's been longer, but...
Well, you're young. You haven't been in it for 40 years.
But we unfortunately have social media that is escalating, and it's very difficult when we're trying to do what is right from our training, from the decades we spend in school, getting licensed, and then having people with perhaps less training and less education in our field trying to review us is a difficult situation to put us in.
Who's trying to review you?
Patients. And it's a little bit challenging to try. Medicine is a little bit different than a random industry because the customer's always right, is the typical business. The patient may come, and the common example, they want antibiotics. They want opioids for pain. I want my Tramadol, doc. I need my Percocet.
What, Tramadol? What's that?
Tramadol.
What's that?
It's a synthetic opioid. It's kind of like, it's a weak type of opioid, if you will.
Okay.
So people who want to, and this is very real, and these are the struggles that we have, because we cannot give out opioids liberally. We're an opioid epidemic because pain was viewed as the fifth vital sign. Many people will say because of industry influence to help doctors be more concerned and more receptive to prescribing opioids for patients in pain, and out of fear of being negatively reviewed.
And it's easy to, if you have to keep a volume of clients and you have to be on time, the easy out would be just the med.
Give the antibiotic, give the Percocet, give the Xanax.
And that's Band-Aid stuff, right?
This is nearly always Band-Aid. There are always exceptions, but by and large, we're talking about Band-Aid solutions. They're gonna, as an example, they're gonna be patients with cancer, terminal, who, they might need Percocet. They might, in their last 5 years of life, their last 6 months of life, they might need oxycodone. But these are the minority.
That stuff's terrible. I took that. Oh,
it is horrible.
It was I had like a crazy dreams, and it was like on psychedelics or something, but not in a good way.
And yet, why do we prescribe more oxycodone in this country than any other country in the world?
This is getting really depressing. So Anthony, bring this ship around.
It's not
give
depressing.
Give us that Hollywood ending. No, not the Hollywood ending. But give us something to go for or hope for. Let's go up here. This is a cool little trail system. Look at how fit people are here, though. You got to say.
This is the way to go.
This is the way to go. It's a nice environment.
People taking responsibility over their own health.
Yeah.
In the context of them having the ability to do so, in an area where the weather is amenable, there is a park, there are sidewalks, we're not worried about crime, we need to recognize we're in an environment that facilitates this.
The system, everything's set here for it.
A lot of places don't have this.
Yeah.
And we never want to blame. Blame games are not how we do things in medicine, but empowering is what we need to do more of.
Okay, so this is the solution. This is where we're going to get out of this thing.
This is one of the solutions.
Okay. So break it down for us, Anthony. Empowering. Other than making good, conscious, sober decisions, which I'm having a hard time with myself. Seriously, with the sweets. That's my one thing. I don't drink. I don't do any drugs. Sweets.
That's good for you. But see, you got to focus on the bright things. How did you cut those things out?
The drinking, ayahuasca.
Okay.
I don't know if that's a positive thing in your world, but it was a very powerful psychedelic that brought me out of it.
Well, then I think
then it was worth it for sure.
There's a point there where you've changed a lifelong habit through one experience. That's a very it's hard to argue against that. Let's put it that way.
Yeah, and I never thought I was an alcoholic. And until you stop completely, it was like there was always a refrigerator humming in the background. Like, those old refrigerators that always make that noise? You don't notice it most of the time, but it's always there. And so every time I was at the, start of a vacation or the end of a long day, go to the beer. And it was nice and it was relaxing. And I'm not like looking down on that or anyone that drinks. It's not my point. But for me, removing it was like it opened like this light came into my life. And by having I'm an addictive personality, so it's either all in or nothing.
A lot of high functioning people are like that.
So by having nothing, there's never a choice. It doesn't take up any mind space. I never have to think about it. I don't battle over it. That sort of thing. So
you just have provided part of the answer. How people feel when they're healthy. People have from childhood oftentimes lived a life unhealthy, and they believe that's the status quo. When they get a taste of what a healthy life is like, it can be life-changing. The example that I like to use in patients is that imagine a tennis ball that's soaked wet. It can't tell if a drop of water comes on it because it's already saturated with water. If you let the thing dry out, you have a dry tennis ball, and now a drop of water comes on it, then you can tell, there's something's different. But we live our lives in a state of chronic stress, chronic unhealthy behaviors from diet, lifestyle, stress from our environments, all the other issues we talked about. It's more than just the patient, it's the environment they live in. But it's hard for them to see what, as you said, the light is like when you live your whole life in the shroud of an inflammatory inflammatory environment.
Yes. Yeah.
But when people realize what it's like, some, not all, but some will never want to go back. That was your experience?
Yeah.
It was personally my experience as well.
So it's the realistic approach, or the cold hard truth is nobody can do it for you. You have to want to do it yourself. Is that fair to say?
That's part of the solution, because
I mean, kids can be educated. Obviously, that is one thing, and they need good examples. But when you're an adult,
you need to have the cards not stacked against you as much as they are now. And our society makes it difficult to be healthy and to be responsible and to accept responsibility for your health.
Why does it make it difficult?
There's money. You need to follow the money when it comes to our health decisions. We think we are in control of our health, and we can be in control, but that's not the message that we are given when we are bombarded from every angle by advertisements trying to peddle unhealthy behaviors. When people make a buck off of our health, it's hard. When people know what makes our dopamine rush, it's hard for us to resist that. And when we target our kids for this, what chance do our kids have? It's mission impossible.
Like I just remember growing up with commercials for Captain Crunch and Trix cereals, right?
Yeah.
I mean, that's just pure crack cocaine for kids.
There is nutrition. It's almost like smoking. Some will consider it to be like smoking, where there is no benefit and only harm.
Okay.
Because the nutritional value of all those things you're talking about is nearly zero, and the harm is incredible.
And it's marketed in a fun, jovial, positive way.
It's all manipulative.
It's all manipulative.
But we're manipulating the health of our kids. This is the health of the future. What chance do we have? And we're surprised that our healthcare expenditures are approaching 20% of GDP. That number, we can't understate that number. When we're talking about stimulus checks and all these things going on, 1.9 trillion is a huge number. Yet we spend so much, unfortunately, on futile medical care every year.
Okay, I was going to say where's the good way out of this? But the whole system needs to change in some way, shape, or form. Well, you're saying the emergency care, or the very, what's deemed as Western style of treatment is nailed down pretty rock solid here. If I need brain surgery, this is the best place to be, right?
Yeah.
Fair to say?
Very.
Preventative, not at all.
No.
And so how does that turn around?
It starts by educating and raising awareness, and by recognizing what cards are stacked against us. When people realize what they're being fed through advertisements and can start to look through the veil that's trying to manipulate them, they get better insight into what their tendencies are and how they're being manipulated to begin to counter those.
Okay. Would you say other doctors share the same frustrations, that you're talking about today? Is that a normal thing?
We're humans like you. We have hearts. We don't want to see people suffering. Absolutely. But we're also suffering from a really challenging situation where at the end of the day, we only have so much candle we can burn before our wick goes out.
Yeah.
And there's a reason why physicians commit suicide at the rates they do.
It's a high rate?
It is a high rate.
I didn't know this.
Physicians burn out. They have moral injury like anyone else, if not more, because we are faced with this incredible burden that we can't do as much as we want about. Because like I said, we're limited to such short encounters. It takes a toll on us.
So you must be pushed between the industry, that's basically the machine, and then the humanity. And when you're seeing that,
and so when we talk about, once a reporter once told me, they said, "Doctor, you can't die from stress." Right? And I didn't even know how to respond. People die from stress all the time. And suicide is one of the most overt signs of that. But did you know that you can go into heart failure from physiologic stress? Have you heard of broken heart syndrome?
No.
Yeah, it's a very, very real phenomenon that we doctors have seen all the time. I've seen it. My wife who's an ER doctor has seen it. When people have strong emotional feelings, their heart can go into failure and they can die. If you want an even better example, before surgery, what we see, classic example about how strong what our thoughts are and how they control the rest of our body. When people see blood, like when an IV goes in,
Yeah.
you know, people can faint at the sight of blood.
Yeah.
That is your brain reducing circulation to the brain itself, causing you to pass out. Your brain is controlling your heart, your blood vessels, causing you to pass out. That is how direct and how fast that relationship is between what you're thinking and the rest of your body. Now, these are examples of bad, right? We're talking about people fainting and losing consciousness and having heart failure, but you can do the same thing as well. You can train your body to be healthier as well, to reduce the inflammatory burden. This is where the non-Western approaches are so powerful. This is where we have Tai Chi and yoga and acupuncture, mindfulness-based stress reduction.
Right.
This is the good side. There's a way out of this. There's absolutely a way out of this. And the best part,
This is cool. The best part is what?
it's cost effective and there's fewer side effects and it's cheap and it's available to everyone. It's available to everyone. You don't need to go to the pharmacy to buy a chill pill.
You know who loses out? And I'm not against capital. I love capitalism and I love investing, but the shareholders lose out of that equation.
If you don't count the patients as the shareholders, yes. If you count the patient as the shareholder, Peter, they win.
Yes, true.
So this is the question. Who is the shareholder in your health and in my health and in everyone in this park's health? Who is the shareholder?
Okay.
Well, it's also other people, an industry that may not have the same incentives that you and I have.
Yeah.
And we need to recognize that at the end of the day, we are the advocates for our health.
So we need to bring that power back. As cheesy as that sounds, right? We need to bring that back to ourselves.
And I hate to say this, it's life and death. At the end of the day, when patients die from a lifelong burden of diabetes or hypertension, you know, that person lost their life. And it might sound cheesy, but it's true. It is a life and death situation where we need to advocate for our own health. We need to be in charge. Because if we're not in charge, who else is going to do it? Your docs, they love you. You know, I love my patients, but I can't do everything.
I appreciate that truth. I cannot export the responsibility of my health to you. You have a wife that's in medical. Do you have kids?
No, yeah.
Okay, so you'll have kids eventually. I'm sure you'll have a family. There's no way that, you know, dozens and dozens of people, I don't know how many people you see or your wife sees, you can take care of be responsible for their health. It's just not going to happen. So that will never happen.
And what is one way of distracting yourself? I.e. cutting the cord. If you don't, if you're not bombarded by those messages.
But isn't it like a whack-a-mole? Like it pops up somewhere else in life. You know what I mean? A lot of times, okay, we're going to get in deep, and this is a whole nother conversation, but I'll leave it very short. A lot of times you're going to something to cover up some other pain. It could be psychological pain. It could be physical pain, right? So finding healthy alternatives to that, which doesn't sound too fun.
No, this is a serious issue. Adverse childhood experiences are one of the difficult to prove because it's difficult to quantify, but they appear to be a very large contributor. Are you familiar with adverse childhood experiences?
Well, I understand what you're saying, like, you know, traumatic experiences kids have in their early years.
And by traumatic, we're talking about things as major as sexual trauma, physical violence.
Right.
They could even be more benign.
Abandonment.
Abandonment, it is very extreme. Correct, absolutely. But even more benign things. We're like at Katrina. I mean, maybe that's not benign, but you're displaced. If we're looking at maybe COVID, not being in school, not being around kids, being around parents that are arguing because they don't have the same income and they need to, economic burdens cause
they lost their
tremendous
business
trauma.
and
absolutely
that comes home.
These things affect the brain and the developing child in ways that are not benign, and this is well accepted in the psychiatric literature. This is unequivocal. However benign they may sound to us as adults, for a child they're very different, and these increase the risk of certainly alcoholism, drug abuse, but also heart disease, lung disease. I mean, the whole spectrum of your health for the rest of your life is colored when you experience an adverse childhood experience. And I gotta say, I don't remember the exact number right now, but it's in the order of at least 50% of the United States population of adults have experienced one childhood adverse experience. It's an unbelievably high number.
Okay, so you can't go back and change that once you grow up.
But
So
But because you said earlier, but you were saying how we have pains that we try to cover up.
Yeah.
This is not, it's not just oxycodone pain. We're talking about pain. Pain is not only physical pain, it's
Yes.
psychological.
Yes,
And
yes.
pain is in the brain.
Yep.
100%, because you don't need to be pinched or to have a knife hit you. People experience pain without necessarily a noxious stimulus, meaning pain is 100% in the brain. It's real, but it is in the brain. Because you can have a painful experience. Some people can get poked with a knife and not feel pain.
Yeah.
Pain is in the brain. So no matter what that source of the pain is, we try to cover it up because we're humans. And there is a cost. One of my teachers once in medical school said, the body keeps count. The body keeps count. No matter how old you were, no matter what you're trying to suppress, the body does not forget.
You can't out-age it. You know, it's not like, okay, I'm 10 years older now, it will go away.
It does not go away.
Until you deal with it.
And this is where
Yeah.
it is empowering to recognize that you can change your relationship with that pain.
Yeah.
You may not be able to cure it. When patients have terminal cancer, they may not be able to cure the pain.
Yeah.
But they can address it. And when I have patients around the time of surgery, if they knew how powerful their expectations in their brain were for managing their post-operative pain, it would be a whole different ballgame. Pain is in the brain, and you can change your relationship with the pain. And if you just want one easy example,
Yeah.
the placebo effect.
Yeah.
We've all heard of placebo.
Yeah.
You know, so many of my colleagues write off, they say, oh, it was, quote, just placebo.
Okay.
Just placebo. I ask you, what does it mean to be just placebo? Does that mean that you have a treatment with no side effects that is cheap? Because that sounds like a really good deal to me. What more do you want? You know, when we have the opposite, we call it the nocebo effect, where instead of the placebo we think of as conferring a benefit, the nocebo is conferring a detriment. Classic example. When we're doing epidurals for women who are laboring,
Okay.
we first numb the skin over the back when we're going to do the epidural. And so many of my colleagues used to say, babe, you're going to feel a little bee sting. A little bee sting. This is a tiny, tiny needle to just inject a little bit of lidocaine to numb up the skin so when the bigger needle goes in, it's not as painful.
Okay.
Sometimes the doctor or the nurse would say, oh, you're going to feel a bee sting. How do you think that preps the nervous system
Right.
of the patient who is in labor? I mean, for goodness sakes, this woman's delivering a baby. They're already in pain. They are legitimately concerned, if not freaked out. And you tell them they're going to feel a bee sting. Peter, last time I had a bee sting, I didn't like it, all right?
Yeah, what if you're allergic to bee stings?
Then you're going to...
I freak.
What's going to happen?
Oh my God.
So this is the power of our thoughts and the
Right.
messages we are fed.
What would you say?
Oh, I have so many tricks. I tell them to cough. This is when I place IVs every day for a living, right?
Okay.
I say cough. You remember saying earlier distraction? What do the people do with the marshmallow?
Yeah.
You tell them to cough, and you gotta concentrate on coughing. And patients almost 9 out of 10, if not 10 out of 10. The IV's in? What happened?
Yeah. I can attest to that. I'm a baby with needles.
It's just distraction.
I'm at my weakest point when I see a needle.
There you go. If you can distract for a hot second.
Yeah. But then we have messaging like this, and we're going a little off topic. But what does that mean? Does everyone must wear a face covering? Does that mean if you're far from people, if you're close to people, stay 6 feet apart? Okay, got that.
And I don't know, this business requires. It might be a little bit unclear because
It's a bit unclear. I find it arbitrary because if we're out sitting in the field, does
getting
this side,
sunshine, getting exercise, and all the other positive things that go with it.
everyone must wear a face covering. So if you're following the rules, and like my wife, for example, she's always gotten the A+. She always did well. Like
yeah.
This is hard for her,
My wife is the same way.
right?
It's
So
funny.
are you supposed to? You're throwing a baseball with a friend, and nobody's around you. Do you need that?
Yeah.
And if you are not doing that, are you doing wrong? And this is a big problem. I think we'll finish it on this. Is the messaging is very difficult. That being from big corporations, the advertising, all the social media stuff we see, then going to a doctor's, learning a little bit about your perspective of it. You know, you have to push a certain amount of patients through. You cannot look out for my best interests, spend hours of your day worrying about that. It's just impossible. It's insanity too to expect that, right? You're not with a mask, it's okay.
We'll live. Well,
And
we're
you
gonna
had
do
your
well.
vaccines. You had your vaccines.
I had my
Yeah, yeah,
vaccine.
yeah.
What are the low risk, high yield benefits we can do every day
Okay.
to improve our health? Yeah, I mean, masks are great in the right setting, but they're addressing like a 0.01%. What are the 1%? What are the 10%? What are the 50% hitters that we can control with our life to not have to be on the OR table one day, to not
Right.
hopefully need chemo?
We don't want to see you.
You don't, yeah, if I didn't have to see another patient ever again, I might lose my job, but I am happy for that. If I wasn't an MD from Stanford and Harvard who practices acute care medicine, no one would listen to me, right? But I've been on both sides.
You have the big title, so people will.
Well, and if that's what it takes to help show people as close as we can get to the truth about what the truth of medicine is, how much we have in our own agency, the possibility of changing our health outcomes around in ways that aren't pushed out to the mainstream, well then, if that's one step closer to the truth, let's do that.
Love it. You got me fired up.
Oh man,
I'm ready. Like, where do I march? Where do I what do I run on? What flag do I hold?
we
Come
haven't
on.
even scratching the surface here. This is
fired
nothing.
up. Yeah,
this is nothing.
This content, guys. You know, we're touching many things. I really think Anthony needs to start a podcast. He does have a YouTube and Facebook channel and a website.
Couple. Yeah.
So I'm gonna leave the links down below. Here, let's walk this last bit here. Hope you got something out of that. I definitely did. I feel healthier just by being around your orbit.
Put yourself in the right environment and the body will heal itself.
Whew, I'm fired up.
You change enough days, you change a year. You change enough years, you change a life. Whose life is worth changing more than your own?
Yeah, fact. And by doing so, you bring those up around you. And you're a good inspiration and role model.
We all are role models for everyone, and that's why we need to practice what we preach. As a doctor, what would I be doing if I wasn't living what I was saying?
Okay, I'm gonna get fit starting today. Guys, I'm gonna do better.
And all of your viewers out there are gonna take this and it's gonna imbibe in them.
Right. Great. Thanks for watching. Anthony, you're awesome.
Thank you.
All right, until the next one.